Hello everyone, my name is Kelli Swank and I'm a third-year medical student here at OSU COM at the Cherokee Nation. Today I'm presenting our research on electronic nicotine delivery systems, most commonly known as vapes. Our project is titled, Rates of Electronic Nicotine Delivery Systems Use in Middle School-Aged Adolescents and Implications for Continued Health Advocacy. ENDS were first introduced in the United States in 2007 as a tool to stop smoking combustible cigarettes. These products quickly gained popularity amongst all age groups and have become the most commonly used nicotine products among adolescents. With the increase in popularity of these products, there's also questions concerning the safety of these products. A proven acute consequence of ENDS use is e-cigarette or vaping use associated lung injury, EVALI. As of February 2020, EVALI has led to more than 2,800 hospitalizations, among which 15% of the patients were under 18 years old. While some studies have reported on the prevalence of ENDS usage in high school age students, there are few studies investigating prevalence and associated sociodemographic factors among middle school age students. We had two objectives for this study. The primary objective is to assess ENDS use by middle school students using the Youth Risk Behavior Surveillance System and assess trends amongst this group from 2015 through 2021. Our secondary objective is to identify disparities in ENDS usage by sex, educational grade level, and ethno-racial groups. We approximated the frequency of ENDS use in the past 30 days before administration of the survey and reported sample size along with the weighted prevalence of these variables. Weighted prevalence was calculated by sex, educational grade level, and ethno-racial groupings. A statistical significance of the relationship between each variable of interest and demographic variables were analyzed using the design-based chi-squared test, and changes over time were determined using the logistical regression comparing later years to 2015 as the reference point. Our results indicated that between 2015 and 2021, 17.90% of middle school students reported ever using ENDS, with 2019 being the year with the highest usage rate at 21.50%. Of those middle school students who reported ever using ENDS, 8.53% reported use in the past 30 days, with 2019 having the highest usage rate at 10.75%. Using the total sample across years did not indicate a significant difference between ENDS use and sex. Overall, the highest rates of ENDS use occurred among Native Hawaiian, other Pacific Islanders, followed by American Indian, Alaskan Natives. The lowest rates of ENDS use occurred among Asians. A statistically significant difference was identified between all ethno-racial groups. The lowest weighted prevalence rate of ENDS use was observed in 6th graders, and the highest weighted prevalence rates were observed in the ungraded or other grade category. Trends of ENDS use among middle school students decreased in 2021 compared to the highest usage rate in 2019. The COVID pandemic closures may have contributed to the decrease in ENDS use in 2021 due to students being isolated from each other. 6th grade had the lowest usage rate, with increasing rates through 8th grade, but with the highest usage rate among those in the ungraded other grade category. Investigation into further defining the ungraded other grade category would be valuable in examining possible causes and ultimately prevention for ENDS usage rates amongst this group. Ethno-racial disparities were found in ENDS use, with Native Hawaiian, other Pacific Islanders having the highest usage rate, followed by American Indian, Alaskan Natives. Future research should include disaggregating ethno-racial identity for both of these groups to further examine use amongst these groups individually. And finally, further research is needed to explore possible causes for grade and ethno-racial disparities in ENDS usage to include targeted marketing and to provide more tailored public health messages for these groups. ENDS pose a risk of lifelong nicotine dependence and can have adverse health outcomes like pro-atherosclerotic effects, compromised lung defense mechanisms, and fatal poisoning with the misuse of e-liquids. We also know that nicotine use during adolescence is known to be detrimental to neurological health. Long-term health effects of ENDS use are still being studied, and even less is known about the early initiation of ENDS usage. Here are my references, and I have listed my contact information, and if you have any questions, please feel free to email me. Thank you.